So the scan which is done in the 3rd month is a little more detailed scan where very gross abnormalities in the baby can be picked up, like absence of head. There's something called as an ectopic pregnancy, in which a pregnancy can remain trapped in the fallopian tube, or it may implant somewhere outside into the abdomen. Now, this is like a catastrophic condition, pending miscarriage. So don't ignore that if there is any spotting, bleeding. In pregnancy, you are immunocompromised. Your body is trying to accept a foreign, the half genetic material is from mother. Of course, I would definitely not recommend to go and eat junk food. But if that's the only thing you can retain, then so be it.
Namaste and hello once again to all my lovely pregnant partners and couples, and also the ones planning pregnancy. I'm Sonia once again with you, your friend and guide from 9 and Beyond, your holistic pregnancy app based on Garb Sanskar, our ancient wisdom of fetus education in the womb. And with us today, we once again have Dr. Deepali Prabhat. Dr. Deepali, a warm welcome to you, and to the audience, and to you, I must tell you that your podcast was absolutely liked and appreciated by the audience, and we got a lot of questions regarding a lot of stuff, because they found it very, very knowledgeable and helpful. So just to make it easy for them, we decided that maybe we should have a series with you trimester wise, so that we can cover up the subjects, and they have like things of first trimester absolutely encapsulated in one part, then the second trimester and the third trimester. Sure. So that's why we have you here again. And for all those who have come here, like maybe they missed the first podcast of Dr. Deepali, she is a clinical, accomplished gynecologist from Mumbai, running her own practice and nursing home for the last 25-30 years. Besides that, a great social worker, a nutritionist, a life coach, as I get to know her better. And she also has her diploma in life sciences, lifestyle medicines from the Lifestyle Medical College of USA. So keeping all that in mind, here she is again to take care of your wellness, your well-being, while you have this beautiful, joyful journey ahead of you. So Dr. Deepali, please can you enlighten us?
I would like to say hello, welcome to this podcast, and I'm so happy again to talk to you, and let's hope that this session is equally enlightening for you all.
It will be. Knowing your wisdom, it will be. Yeah. So to begin with, doctor, starting on the first trimester, let's just start with the signs and symptoms of pregnancy.
Yeah.
The key signs of healthy pregnancy, whether the person's heading into a healthy pregnancy, and the symptoms which come with it, bringing in the physical changes, and how to deal with them.
Right. Yeah. So the commonest sign of a pregnancy is, of course, missing the period. That's the most common. Though rarely we can have cases where the menstrual period continues as it is every month. That is quite rarely, but it can still happen that the woman has a period, yet she is pregnant. The second commonest thing which comes up is feeling tired or fatigability. And it's basically because of the hormonal changes that is happening.
Right.
The levels of progesterone hormone increase, and that give that tiredness. And of course, the entire body is now gearing up towards another function, of the body. So tiredness is very common. Then as the hormonal levels rise in the body, certain other parts of the body which are associated with the reproductive system, like the breast, so there may be breast tingling or tenderness. That can start early in the pregnancy. And then in many, you can start getting nausea or actual vomiting. So this is all kind of dependent on the pregnancy hormone levels. Also depends on the, kind of state of mind of the pregnant woman, how much she has planned the pregnancy, or is it sudden? Is there any stress? So the amount of nausea, vomiting sometimes, the severity would depend on that. If it's a planned pregnancy, you're very relaxed, then the chances of the nausea, vomiting may be a bit less.
Yeah, last time you said that, and to me also it was like such an eye-opener that nausea is rejecting the food like in your body. It's the same way.
Yeah, so it's
Excessive-
protected.
yeah,
It is
acts of
protected as
protective
well as
mechanism, yeah.
on an emotional level also I can signal that rejection. And so these are the common ones. The lesser frequent are increased frequency in urination. Okay, so you feel like going to the bathroom more frequently, also because of progesterone hormone. That is, it's like a diuretic hormone, so that causes that. And of course, as the pregnancy goes, also there may be little pressure on the urinary bladder, so that also can cause the increased frequency. Very rarely, there may be like crampy pain, which is similar to a menstrual pain, which is would not be a very good sign. But that can happen, and it always need not be alarming. It may be, a part of a normal pregnancy as well.
Okay.
And
But should be taken care with the immediate
Yes.
medical attention, right?
definitely,
Should be considered like a red flag.
definitely.
Okay.
And maybe alteration in the discharge, because now the hormones of pregnancy, which are estrogen and progesterone, both are increasing. So the kind of vaginal discharge also may change.
Right.
So these are the few things which can, make the women believe that she may be pregnant. Of course, we would confirm by doing a urine pregnancy test, which is the most common thing. And also it can be tested in blood where, you do the beta HCG level in blood. So these are the earliest signs that the woman would feel. And then when she visits a doctor, of course, other the examination findings and all will kind of confirm that yes, you are pregnant. Right. That would be the early signs of pregnancy, what you would see in the first truth. Starting from the missing the period to it peaks about up to 2.5 months. Thereafter, even the nausea and everything will start fading away. So it is kind of related to the hormonal levels as well.
So considering that fatigue, like you said, and nausea, like one of those very common symptoms which probably we all were aware of, leaving aside the rest, right?
Yes.
Any special recommendations on how to deal with it?
Nausea, of course, one is related to the pregnancy hormone level. So, I mean, if you have nausea, somewhere it's a healthy sign that yes, the pregnancy is doing well. That means the beta HCG levels are high. Well, that is one reason for the nausea.
Okay.
So that's a good thing. And suppose you suddenly have disappearance of the nausea and vomiting, then that may be a red flag. Suddenly, early in the pregnancy.
Okay.
Then it may be kind of correlated. Maybe there may be something, some issue with the pregnancy. Then how to deal with it is, of course, by regulating your intake, because it is certain things will trigger the nausea.
Okay.
One is remaining without food for a long period of time, typically which happens in sleep.
True.
So when you eat and then go off to sleep, the body is like, stomach is empty, and morning when you get up, typical the woman will get up and start puking.
Right.
She will have like bitter taste in the mouth because all the contents of the stomach and intestine are coming out.
Right.
So to stop that, it's good to have like a bland, like a biscuit or a khakra. Keep it on the bedside near the table and near your bed,
Right.
and just have something in the morning. That will take care of the immediate nausea.
Right.
Then, of course, try to pace the meals so that, you're not prolonging the interval between two meals. Avoid very spicy, very oily, and basically outside food. Try to take whatever is easy to digest. That will reduce the nausea. There are very good home remedies like ginger. And, sometimes they say just take some honey and ginger and have a bit of it. That takes care of.
Any time of the day or the morning, you're talking about early morning.
Throughout the day, whenever you feel nauseous, it's like, and sometimes some women, the nausea is triggered by certain smells.
Okay.
Smell of cooking, smell of a particular food product, all that. Try to avoid that. And of course, in allopathy, we do have very good medications which are very safe. So that is always available. But we could try all these home remedies, and otherwise we have a medication which can be taken depending on when the nausea peaks, which is typically in the morning. So we recommend it to be taken at bedtime.
Okay.
So the effect kind of remains throughout the day. Additionally, if they need more doses, they can be taken. It is, well tested during pregnancy, and it can be taken.
Right.
And that's how we control the nausea and vomiting. And usually by the third month, the end of the third trimester, it will reduce.
Right.
And then the appetite will come back, and
Yeah.
it's also like you don't really require a lot of nutrition during the first trimester because the pregnancy is quite tiny. The requirements are less.
Okay.
So you don't have to start eating for two, and just because you're pregnant, go on having everything and right. So
You can listen to your body.
you can listen to your body. You can try to limit yourself to the things by which you are, you remain well, and that nausea doesn't get triggered.
Right.
So that is good enough. Also, it's like a protected mechanism. I said the body is rejecting things because it doesn't want to harm the pregnancy. So, like,
Right. Yeah.
a certain thing, if you're repelled by, then just leave it. Just
So basically, nausea is a very positive thing.
it can, right? It can be protective as well. But of course, if it goes to extreme where women are just unable to retain anything, then of course you have to hospitalize. We just give, also it's also related to the mental state of the mind. Like stress can really exaggerate all these. So the moment we hospitalize, we take them away from that environment. They do well. And then slowly we start give them some IV, and then make them start eating, and then they usually do well.
So, doctor, while you're talking about it, suddenly hits me that today most of the girls, women are working women, right? They have early mornings. There's lots happening in their house, whether it's their firstborn or just their family or them rushing to work and everything.
Yeah.
So, keeping all these things, and we are talking about the first trimester.
Yes.
Any special recommendations which can help her have a smooth morning so that
I feel, planning is very important. So I should take some time to plan the meals. Okay. And you could have fruits ready. There are a lot of things which are, you don't really have to spend much time, cooking or something. So you have few snacks ready. So you have fruits to go, maybe some chopped vegetables like you can munch on, some nuts, some seeds, some boiled legumes which you can, whip up quickly for a small snack.
Right.
And you can kind of, if you plan the meals ahead, do some prep ahead of time, then that will save a lot of time. Try to go for like single pot meals where, you're getting with the entire nutrition.
Yeah.
So for working women, I always recommend that.
Okay.
That don't spend too much time on. You don't have to have 5-6 dishes separately. You just see you're getting your main macronutrients and micronutrients. Okay, so your good balance of your carbohydrates, complex carbohydrates, proteins, fats, and your vitamins and minerals, which are abundant in vegetables and fruits.
Perfect.
So if you kind of plan it well, and you kind of have a good mix of vegetables and fruits, say on an average they say about if you eat 30 different types of vegetables and fruits, you will probably get all the micronutrients that you need, the vitamins and minerals.
Is that one per day?
No, overall in your entire diet, like you have that much variety of the rainbow, like all different colors. You're good.
I think that's a great point.
You don't require a lot of supplements. So you need to have that.
Perfect.
And of course, you're try to stick to minimally processed products, which are which will be whole. So they are slowly taken in by the body. It doesn't raise your sugars, all those things. So planning is important.
I'm also suddenly realizing that end of the day, it's your planning which is very important. You should be prepared for a smooth morning, which means your prep should probably be done a previous evening. So when you get up in the morning, you're calm, your things are in place, and that will probably help.
Or even prep during the weekend.
Yeah, absolutely.
Just give half an hour, plan the meal for the whole week.
Basically, planning is the key. Let's put it like that.
Talking about planning for the whole pregnancy, planning what things. Planning ahead helps a lot.
Absolutely.
Saves a lot of wastage of time.
So while we are at nutrition, because nutrition and diet, I think, is one of the most important pillars of pregnancy, and taking care of your well-being and the fetal development. What are your dietary recommendations for the first trimester?
So I think this is one time where we are not very strict. And don't look at having everything on the plate. Just go by what feels right to you, gives you the energy to go about your day. Then it can be, if you feel like eating rice or you feel like eating dal or whatever, you're not so finicky, because at the end of the day, it's about retaining something, because you have all this nausea and all that.
Yeah.
So, of course, I would definitely not recommend to go and eat junk food. That is for sure. But if that's the only thing you can retain, then so be it, because you just need the calories.
Okay.
But that's the only, leeway I give only during the first trimester to my patients. Because if they just can't have anything, then just, okay, you are.
Okay.
But after that, it's, for you and for your baby, your food is the most important, because finally you are what you eat.
Absolutely.
So it is going to affect you as well as your baby. So we have to be very strict from the second trimester onwards. First trimester, if you are able to stick to a healthy diet, absolutely good for you. But a little bit we can accommodate.
Right.
So, we would like a balanced meal which has, good amount of complex carbohydrates, so which can be any of your grains. That should be like 1/4 of your plate.
Okay.
Half of your plate should consist of vegetables, mix of vegetables and fruits, in which, of course, almost 4/5 will be your vegetables, which are preferably seasonal, locals.
Okay.
If you can get organic, so that you're trying to avoid the pesticides and all that. And some fruit. So at least one fruit per day, I would suggest. If you can take more, it's very good. So if you can take about 8 to 10 servings of vegetables and fruits throughout the day. Okay. But if you want to compare it in a plate form, then half should be vegetables and fruit.
Okay.
1/4 should be a grain. It can be rice, any of your millets. It can be wheat, whatever you like. And 1/3 should be a source of protein, which can be your dals, legumes, animal protein, fish, chicken, egg, dairy.
Okay.
All that, preferably from a minimally processed source, and a reliable source is what, is the proper plate. Nutritional plate, which is for otherwise also we recommend that for everybody, whether they're pregnant or not.
Yeah.
In pregnancy, as the second trimester onwards, we would increase the need for protein. So that has to be a little more looked into.
Okay.
But first trimester, it's fine. Okay, you can try to have 80% like that, and 20%, okay, you can have
Indulge.
Be happy. Definitely. Yeah, that's more important. Mental peace is more important during that period.
Okay. And while at nutrition and diet, how important are the other supplements and vitamins or iron or whatever is recommended? And how does it impact the fetal
So
growth?
one vitamin of which there is enough evidence to prove that it has to be available in the pre-pregnancy and during the early pregnancy period is folic acid.
Okay.
So generally we recommend women who are planning a pregnancy to start it at least a month in advance before they become pregnant. They've not been taken it. As soon as the pregnancy is confirmed, we start them on a folic acid supplement. So we really don't go about testing the levels or anything. We just start them on a folic acid supplement, because a deficiency of folic acid has been known to increase the risk of neural tube defects in the baby. So that is one vitamin which definitely we recommend.
Very important.
Vitamin D, generally we like to give it pre-pregnancy. During the first trimester, we generally avoid too many things, because lot of medications are not tested on pregnant women. So we don't know, the benefit and the harm.
Right.
So we try to avoid, and usually iron, calcium and all the other supplements will start once the nausea is reduced.
Okay.
Once the requirement is a little more, by the end of first trimester, we would start the other supplements. But folic acid is something which has to be taken during the first, on day one
in advance.
pre-pregnancy, or as soon as you diagnose the pregnancy, because I think that is one thing which every pregnant woman should be having. Of course, we have folic acid available in the natural, in the vegetables and fruits, but I feel it's better to take a supplement. That is one supplement which definitely should be taken. Yes.
And since we are at the topic of supplements, I mean, is there any medication which, like, suppose the person has preconditions of maybe diabetes or thyroid or hypertension or any other chronic thing for that matter, could be migraine, whatever. So, any changes are required in that part also?
Yes, definitely. Because actually, if you're planning a pregnancy, then if you have a chronic condition like, say, epilepsy, or you're on anti-tuberculosis treatment or something, then if the pregnancy is planned, or if suddenly the pregnancy happens, we ask the patient to go and see that doctor, because certain medications are not suitable to be taken by pregnant women. And there are alternatives which can be, replaced.
Okay.
So we can change the medication.
There are safe alternatives.
There are safer alternatives, which are probably not the ideal ones, but definitely recommended for the pregnant women.
Right.
So then there is a change of medication which is required. So any person is on any chronic medication, it is good to go back to the doctor and tell them that, the primary physician, whoever you are under, I'm pregnant now and can I be taking this? Of course, many times the gynecologist should be able to guide you.
Right.
But it is still better, because the medicines are getting so much advanced, and every time a new molecule comes, and it may not be possible that for the gynecologist to know each and everything. So it's safer to go back and adjust the dosing and everything. So it is required that those doses are adjusted. Also, certain drugs can reduce the folic acid levels in the body. So then we need to give a higher dose of folic acid. So also, if there are, previous history of a neural tube defect in a previous pregnancy, like a baby having affected, then also we need to give a higher dose of folic acid during the first trimester. So those are the things that we need to tweak a bit.
So now that we have a better knowledge about the nutrition intake, I think another important part is your physical activities.
Yes.
Right? So how much? Yes, no. What is your take on it?
I think every human being needs some amount of movement.
Right.
Okay. So every pregnancy you are on a physical activity program, you can continue it, because the body is already used to it. Okay. Only if it is excessively high intensity, then it is better to listen to your body. And, if you experience any discomfort. So what happens is, during a high intensity workout, the body gets heated up. There's a lot of generation of heat and sweating. This temperature change is not very good for the pregnancy. So that is why you have to keep on hydrating yourself and all that. Okay. So physical activity can continue. Definitely, we can't advise to start a physical activity during the first trimester.
Okay.
Okay, so if you're not already exercising, then you can just do mild movements are fine. But be active, obviously, as everybody is.
Right.
But don't go to start a new, join the gym or start a pregnancy kind of physical activity program in the first trimester.
Okay.
That can be done after the first trimester is over, and after ensuring that there's no high risk for a physical activity for that person, then they can go ahead. Okay. So that is one. As high intensity, so adventure sports is something which is not recommended. Maybe going to public pools where you're not very sure about the hygiene. Because swimming is an excellent exercise, but only if you're sure that, it's safe, then it can be continued.
Right.
So these are things which should not be done. Like, anything which is high adventure, which increases your cortisol, you can say, suddenly gives you a high. That is not required in pregnancy at all.
Okay.
And later on, of course, just so keep moving in your natural way. Don't be sitting at one place. You're not sick if you're pregnant. Go about doing your normal activities. And definitely join a good program if you're not already exercising once your first trimester is done. That is it is extremely beneficial to have a good physical activity program. Like it can be yoga, it can be, some kind of aerobic activity. It's always good because it affects the body as well as, it's like a stress buster.
Right.
So it's definitely advisable with all these precautions. And there may be certain contraindications which can, come up. Suppose the placenta is low, you're experiencing some cramp-like pain. If you're experiencing spotting, these kind of things, we will, limit the physical activity, surely.
So these are out of turn things which will limit your activity.
Yeah,
which as per
obviously the doctor will let you know that, you should not be strained so much.
like you said, if you are already exercising, right? So for example, like I have arthritis and I'm doing weightlifting and all, like, for my bone density. Is it okay to continue that weightlifting just to bring down that thing?
Yeah, so the body will tell you. So it's weightlifting is what you're activating that particular muscle. Now, if you're doing like a biceps exercise, if you're able to use only your biceps and do that exercise, that's fine for the pregnancy. But if your entire body is strained, like your abdominal muscles and everything, so it's like a pressure on the body that should be avoided. During the first trimester. Yeah, completely.
Right.
So the body will tell you can tone it down. So any kind of heavy workouts, you have to definitely tone them down in the first trimester. And later on, if you're comfortable, you could continue with, at a moderate level where, you're comfortable with that.
Perfect.
I mean, there is no complete contraindication unless there is a contraindication. Yeah.
So like, based on physical activities and stuff, what are these other activities which, let's say, the do's and don'ts of the first trimester, which we can say, okay, do this and don't do that?
Yeah. So one is the physical activity. The second is the dietary aspect. So we don't want you to fall sick during the first trimester. We don't want you to be taking any medications because most medicines are not tested during the first. So definitely avoid any food from outside which is not heated. So, when you heat a thing, all the bacteria will die off. But if you go for like a salad, sandwich, chaat or something, that is likely to be contaminated. So that is one thing which I'll ask, women to avoid during the first trimester. So don't fall sick during the first trimester. So avoid that. So that is from diet. Similarly, from the environment, don't go and visit sick people. Don't go around sick children. Like, you feel but you can catch it very easily.
Right.
So that is one thing which you want to avoid. Second is avoid all kind of chemicals. Like maybe your personal use chemicals, it could be your creams, cosmetics, kind of thing. So unless you know that they are absolutely safe and don't have certain, because lot of things now are coming up about a lot of chemicals being there and we don't really pay any attention to them. So I would, unless it's like a physical thing like waxing, it's probably okay to do. But any kind of hair removal cream you're using which is chemical based, or any kind of cosmetics which you're using which have a lot of these parabens and those kind of things, I would definitely say stay away from it. Or even in your household utility things where, or certain perfumes on your body or something, because everything, is going to come in. So try to go for more natural replacements. During pregnancy is what, it's a good start, and maybe if you like it, you can continue as a lifestyle change.
Yeah, exactly.
Because we are surrounded with chemicals and we are not conscious about them. So, the moment you start reading the labels on the back of your, all your products, maybe it a food product or maybe something that you apply to your skin. Finally, all these are ways in which things enter your body.
Yeah.
So you have to be mindful.
And like last time you said, if it's not in your, it's not in your kitchen, what is on the label, it's not for you.
Yeah.
And
that may not be true for a cosmetic, but still. I mean, definitely there are certain chemicals which are definitely to be avoided, and you are mindful that those are not there, then it's much better.
Any other activity which you can think of?
Yeah, and then the last and very important is intercourse, which is a part of a thing. So we generally ask them to avoid during the first 3 months. There may be certain contraindications for it throughout pregnancy also, if there are like placenta previa and things like that. But we say avoid intercourse. Of course, unless the woman doesn't know that she's pregnant and she continues with it, that's a different thing.
Right.
But we just ask them to avoid intercourse during the first trimester.
And how safe is it to have an occasional glass of wine, or which is such a prevalent thing?
Pregnancy, I feel there is no safe level of any toxic substance. So I think no alcohol, zero alcohol,
Absolutely.
zero tobacco in any form. And
which should probably start while you're planning your pregnancy, if I'm not mistaken.
Obviously, yes. Pre-pregnancy, because it always takes some time for it to get washed out.
Yeah.
So there is no safe limit. Though, of course, there are safe limits for non-pregnant women, which to my belief, it's not really safe. But for pregnant women, there is no doubt that zero alcohol, zero known. I mean, we know that tobacco and all these products have so many of toxins, so that is a no. And of course, all other substances also a no. So that is for sure. Sorry,
I remember we had one session with Acharya. He put it very beautifully that जब आपके घर में कोई मेहमान आता है तो आप उस दिन स्पेशल केयर करते हैं कि आपके घर की सफाई बहुत अच्छी हो, आप उसको थोड़ा एक्स्ट्रा सजाते हैं, आप थोड़ी अच्छी ज़्यादा क्रॉकरी निकालते हैं because you have guests over. Correct. So same way you're welcoming a new baby, a soul, such a good life.
He put it.
Yeah, he put it very beautifully. So make sure that you are very clean yourself in your thought, in your body, in your nutrition.
Absolutely.
You know, the purity of it is what I'm talking about. I really loved it the way he put it as an example, so that's exactly what you're saying, that so there has to be a purity in you first before you welcome the baby there.
Absolutely. That's true. So I think everything, like the food, the physical exercise, the avoidance of all these things, very important. And of course, sleep is it's the repair phase of your life. So I think that is something,
one of the most important things.
Yeah, because whatever wear tear is happening during the day, the body is repairing it in the night. So pregnancy and sleep are some women do have problems, right? But we do the best that we can, I feel. So that is also something to be taken care of.
Yeah, and coming to the sleep and things like the emotional well-being and the stress management, especially women who are working. Of course, housewives also have their own levels. But what I'm trying to say is that today life is so challenging. There's so much competition all around you that so I think we are aware that emotional well-being and stress impacts your fetal development. We are very aware of that. So how do you recommend taking care of this most important part of the health while planning pregnancy and during your first trimester?
So basically, you have to understand the mind-body connection. Your mind is composed of thoughts. So what you think, you can generally just hold one thought at a time. Okay, so what thought you hold, that is going to affect your emotion. So emotion is also what you feel. Okay, then what you feel is going to, have an effect on how you're going to behave. Yeah. Okay, so that's the action. Okay, action is also connected to habit. So when you do the same action repeatedly, it becomes a habit. Okay, and all your good habits or bad habits are going to affect how physically you're going to be. So that's the connection.
Wow.
And the habit again connects, the mind. So if you understand this connection, so stress is again related to that. So it starts from a thought. When they say you be mindful, what it means, you be in the present moment. Don't think about the past, don't think about the future. Because these are two times because of which you get stressed. You get stressed because of something which has happened in the past, or you worry about something that may happen in the future. Okay, and that causes your body to go back to the protective mechanism that humans have. It's like the flight or fight response, that has evolved with our genes, because earlier we used to never live in these safe environments. You were in the wild and we had to face a wild animal in which you had to either fight with it or run away from it.
Right.
So our levels of hormones are geared up to that. The moment you have that kind of a response, the cortisol levels or the stress hormone levels rise. Same thing can happen in a phase where you're sitting in your house, but you're thinking about something. And suddenly you have that stress. It gives the same response. Your stress levels increase. And stress hormone increase, which is cortisol. And that is going to affect all the other hormones.
Yeah.
Because it's all interconnected through the bloodstream. So your thyroid hormone will get affected. Your reproductive hormones will get affected. Your insulin will get affected. Everything is interconnected. And that is why it's very important to be mindful of the stress. This is my stressor. So I'm not going to pay too much attention to it. I'm just going to try to find a solution to what problem is there in front of me.
Right.
And work on it. So you don't react to a particular thing. You respond by thinking and try to go for a solution. If there are certain things which you can't change, you just accept them. So either you change or you accept. If you have this kind of clarity in your mind, then every problem has a solution or a phase of acceptance.
True.
So the stress actually doesn't come from the situation so much as it how you are reacting to the situation, which is totally in your control or largely in your control if you're aware of it.
True.
So I think if you approach it in that manner, then you realize that the moment you keep the stress levels low, your cortisol is low and you're actually helping your pregnancy. The moment the stress levels are high, this whole cycle is going to come in, because once you have stress, you're going to feel bad. You're going to feel sad. Okay, so that's
And probably guilty also because you're aware as an educated person that this is not good for my fetal development.
So emotion is going to go away bad. The emotion is going to reflect into what you're going to do. Because emotionally, you say stress eating, okay, you go for a junk food or something, you're going to stress eat. Okay, that's your action. And that is going to have some harmful effect on your body. So it's all connected. Once you understand that, then you're mindfully, okay, now, this is what. And that's where all your, meditative practices, yoga, chanting, and all that is to help. Music is all going to help in,
Keeping you calm.
keeping you with one thought at a time. And, getting rid of all those thoughts which are from the past or from the future.
I think you've really, really put this very, very beautifully and so simply. Be in the moment, single thought. Then how, react, don't react, respond. I think that's an amazing statement to follow principally in life, that try not to react. Aware of this situation, that there is a difference between reaction and response.
Yes.
I think it's a great journey to begin with, right? For your emotional
First you're aware and then you start practicing it.
Right.
And then it becomes like a habit.
Right.
It's like how... Absolutely. And you certainly can control your thought. And once you are able to control thought, the entire... Now the circle gets controlled.
So, again, I'm going back to Acharyaji. He said it so beautifully. Ahar, Vichar, and Vyavhar. If these three things are in place, correct, you are in good space. And that's exactly what you are saying right now. Absolutely. So that's what Garbh Sanskar is all about. Yeah. And that's the connection between the modern science and our spiritual Vedic science. Absolute connection, amazing this is, So this is like a general thing, right? But see, there are situations in today's time. Yeah. People are going through a lot of difficulties. There are a lot of challenges which are not really normal. So it's easy said than done. How do we deal with that?
Women are multitaskers. So they are super beings, like superhuman beings. Right. They want to do everything. So that is one thing which I tell all my patients, that please take a backseat, prioritize your pregnancy. Don't try to juggle too many things. Like one thought at a time, it means one task at a time. So once you have that additional task of now nurturing a baby, you make a priority list and do things which are absolutely important. Please delegate a lot of things, maybe to your partner, maybe to your siblings, in-laws, whoever, or, people, your help.
Right.
So try to delegate the tasks so that you are not overburdened. And this feeling of overwhelming, which you get, like you said, if you have a child, who also needs some attention and you're pregnant, and that is going to stress you out.
Yeah.
So try to, reduce your responsibilities, try to do the best you can, and try to see that you're prioritizing yourself and your child. So of course, you have to have that kind of balance. And, many times this is not a period which is going to keep on coming again and again in your life. So I completely agree that career is important, work is important, no doubt about it.
Yeah.
But this is also very, very important. So we have to put our priorities in the right perspective, try to balance things, and that is going to help. So please take help. Don't hesitate. Don't feel bad that, I'm telling somebody to do this thing for me or that. It's fine. You are also doing a big important job of, carrying a baby.
Yeah.
So I think that's the way to go about it. That reduce and manage, manage your responsibilities. Try to leave away few things which are not important for the moment. Take help from your spouse, in taking care of a elder child, and divide your responsibilities. And that's the only way of, reducing stress, because stress can be physical, emotional, mental, all kind of stresses can exist in anybody's life, right?
Yeah.
So you have to deal with everything. So that's where the response part comes, where you think about it and rationally think what can be done, rather than, just running from one thing to the other, and then, end of the day, you don't have time to look after what you're eating, whether you're getting some time for yourself. All those things are important.
This is a time of extreme awareness, actually, in all departments of your life.
Absolutely.
So the moment you're aware of what's happening, you can deal with it. And in cases like which are more extreme, probably due to some extra circumstances, I don't think anybody should shy from professional help in today's time. It's a very normal thing to do.
Not at all.
It's like going to any other doctor.
Absolutely. And of course, pregnancy itself, because of the hormonal changes that are happening, will bring about some anxiety feeling and some mood swings. Suddenly one day you're absolutely fine, the other day you're teary and very labile emotion. That happens. It also scientifically can be explained by the hormonal changes that happen.
It's true.
And of course it is also because you have to deal with lot more things. So all those are there. So as I said, the common things which I told you were the easy ones, where you delegate jobs to other people, but don't please shy away from taking professional help, because there is a lot of things when you meet a professional counselor, they can help you put things into perspective.
Absolutely.
Which sometimes you lose. And very rarely, of course, medications usually are not required. We generally do.
Just counseling is enough.
But most of the times it gets dealt with just by counseling.
Yeah, it's high time that we come of age where this department is concerned, that nobody should ever shy away from getting professional help when it comes to the emotional well-being.
Very, very important.
Yeah, it's like if you have viral, you go to a GP.
Absolutely.
This is like the virus in your brain, you go to a psychiatrist or a psychologist, whoever. So I think it's really very important in today's time to understand the reason.
And the pressures of today's times is quite different from what it was
Absolutely.
few decades ago. Women didn't have all these responsibilities. You have a job, you have a home to take care of, and you're really juggling between too many things. So the chances of getting overwhelmed are very common.
And doctor, I'm aiming absolutely towards the supporting partners, because these days couples very proudly say we are pregnant. It's no more like the wife is pregnant. So if we are pregnant, please give the guidelines to the supporting partners of how can they help. What are the list of things
I think
which they can do to ease her life out.
So we are pregnant is absolutely a reality, because
and it's a beautiful thing of your realization.
The egg and the sperm to make the baby.
Absolutely.
Women are just biologically caring and carrying the pregnancy.
Right.
That is of course there, but I think just as much as the emotional health of the woman is important, so is the partner's emotional health, physical health. All aspects are equally important, because they are going to influence the woman, isn't it? Indirectly, the environment, it's the immediate environment of the baby. So it's important for the partner also to take care of his health. And it also helps, you make the same dietary changes that are going to, so you don't have to cook separately for two people. You start eating the way, that's your way of contributing to the...
And make her feel better. If she's not eating that, I'm also not eating it. That's a beautiful way to support.
Exactly. So, or go for walks with your partner, it's like showing your love and support. And
absolutely,
that's another way of... And of course, trying to do some of the tasks that she would have otherwise done, helping in household tasks, looking after the child. I think most of the generation, at least I am doing it now. They are doing it, going for antenatal classes and understanding about pregnancy, like, as a team.
Bilkul.
Where, even if those changes are not happening in you,
Right.
if you know what's happening to your spouse, then you can identify, why a particular person is feeling that way, and it's normal to feel that way in pregnancy. If you are knowledgeable about that, you will be more empathetic.
Absolutely.
So that is, I think that's the way a spouse can support
the both physical and emotional load together.
Both is important.
Absolutely. Yeah. Perfect. Yeah. So, like you just now used the word antenatal, so that reminds me, doctor, in today's time, there are a lot of tests recommended during the first trimester, what we call the prenatal care, right?
Yeah.
So, and there's a lot of confusion regarding that in everybody's mind because, people have the general mindset, कि doctor extra test करा रहे हैं, which is not really true in today's time, right? So, how would you explain that?
So previously, like say a few decades ago, we had like a pyramid of antenatal care wherein, the initial antenatal visits used to be few. And then towards the end of pregnancy, the doctor would call the patient more often.
Yeah.
And now what we have is an inverted pyramid of care. That means maximum things or testing has to be done in the first trimester.
Right.
And then we can, find out which pregnancy is going to be a low risk one or a high risk one. So that categorization happens right in the first trimester. Okay. So when a patient or a woman approaches us with a positive pregnancy test report, is when we would, do a detailed history, try to find out if she has any, past medical illness or a surgery, or she's on any medications. Generally have a knowledge about what her usual diet is like, how her, exercise, physical activity plan is like that. And then, of course, we recommend the folic acid supplements. And the first confirmation of a proper pregnancy is by doing a dating scan. So we do ultrasonography, say around 6 to 7 weeks of pregnancy, wherein we can confirm the heartbeat of the pregnancy. And that kind of says, 95% now this pregnancy is going to go the correct way. That kind of ensures that,
Okay.
it's very important that once that is there, you would expect only 5%, some problem.
That's amazing development.
So that is like, done like within few weeks of missing your period. So that's the dating scan. And also if the woman had irregular cycles prior to becoming pregnant, and that helps us to know the exact gestational age.
Okay.
And then decide the date of delivery. So that dating scan is important, especially for women with irregular cycles.
Okay.
Otherwise, all right, maybe, if that is one scan which is not done, fair enough. The second is one level of test that we need to do. Like basic, like we do a complete blood count, we do a urine routine to look for any infections or like, any diabetes, sugar in the urine, like, pre-pregnancy, if there's an existing thing which the woman is not aware of. We do the thyroid hormone levels. We do a fasting blood sugar. We do a HbA1c, which is like, tells you how the sugar has been in the last 3 months. We do a hemoglobin electrophoresis, which kind of tells you whether is there any abnormal hemoglobin like a thalassemia, which the patients may not have been tested for all that. So this is the time to find all these things out. We also do an infection screen, which is like a HBsAg, HIV, and HCV. These are all viral infections. Suppose there is, a chance of that being there, then that we have to take extra care. And a VDRL. So these are the infection screen that we do. And we also do aneuploidy screening. What it means that there are certain common chromosomal abnormalities in the baby, which the pregnancy generally is unlikely to continue, or there may be major abnormalities in the child. So we do a screening test called as dual marker, which tests levels of 2 chemicals in the blood, which is pregnancy associated protein and free beta HCG.
Okay.
So combined with that and a sonography which is done in the third trimester, we do it between 11 and 14 weeks. That is called as the nuchal translucency scan. Okay, so there is a small space behind the nape of the neck that is measured, and that has been shown to be associated with certain chromosomal abnormalities. So the scan, which is done in the 3rd month, is a little more detailed scan where very gross abnormalities in the baby can be picked up, like absence of head, certain hernias, and we can pick that up
That early.
That early it can be picked up. Also, we look at the nuchal translucency, we look at the presence of the nasal bone. And there are certain, like, if there is a chance of cardiac defects in the baby, like right now the heart is not developed, but there are certain features like they look for tricuspid regurgitation and a ductus venosus flow. So these are certain characteristics which are recorded in the first, the NT scan. And also we look at the blood flows from the uterine arteries. So all these it's like a screening scan to predict certain things that are likely to come up during the pregnancy. Like you can predict hypertension that may happen by doing all these tests right in the first trimester.
And it can then absolutely...
Yeah, and then it can make us alert, and we can take up certain steps to, kind of prevent it.
Absolutely.
So all this testing is very, very important in the first trimester itself. And that's how the first entire care is now focused on the first trimester.
Right.
So all these blood tests with the ultrasonography is done, as I said, between the 11 and 14 weeks, which is like the end of the first trimester.
Right.
And once we do all this, then we can categorize into, say, this patient requires like a high-risk monitoring, they need to be seen more often, and kind of things. And then if you are a low-risk pregnancy, your doctor may just keep on calling you once a month. Okay, right till the end of pregnancy, Unless, of course, certain factors come up during the pregnancy, then again you may be recategorized into a high-risk one.
True.
But that's how we go now.
Yeah.
So first trimester is extremely important in terms of, going to the health provider and getting all this tests.
In a way, if you look at it, generation is really blessed that the science technology has taken them so far that they have so much information to deal with.
Yeah.
And then they have the knowledge of the ancient wisdom of gut sanskar to deal with these things.
Correct.
Besides taking in the medicines, you can clearly see the connection, doctor. Like, I'm suddenly realizing we've had podcasts with homeopaths, Ayurvedas, and the spiritual leaders. There's such a beautiful connection in all this, right?
Yeah.
You kind of get informed about what you have. Like allopathy does all that for you. They have treatments for it. And your other sciences are taking care of your emotional well-being also to aid this process.
Absolutely.
Isn't it?
Absolutely.
So in a way, can we say that it's a great thing to basically have a combination of all this in your life?
Absolutely.
As an allopath, would you recommend that?
Definitely. I think you can go for any kind of discipline which works for you. Like homeopathy is good, very good for certain chronic things.
Yeah.
But I would definitely advise go to an expert who knows this subject, that kind of a thing.
Yeah.
And there are many things allopathy doesn't have answers to or doesn't have cures for. So, I mean, it's not that like, we are everything. So I say, please take care of whatever is available to you. Whatever is safe is important. And I'm sure the expert will guide you regarding the safety of any, use of a particular discipline.
Stand with each other, I think.
Yes.
I think it's very important to keep everybody in
the front. If you're taking something, let
your
person of the alternative medical practice know that you're pregnant.
Yes.
That's very important. And let your allopathic doctor also know that you're taking all these things. So at the right time, they can, kind of...
Absolutely.
At the end of the day, of course, not many studies, as I told you, are done in pregnancy.
Absolutely.
So you would like to avoid as many things in the first trimester.
So it's basically work hand in hand.
It works for you because you are, at the end of the day, a unique person, right?
Yeah. True.
It's a particular way of life may suit you better. True. There's no harm in following that.
Yeah. So coming to the medical aspect again, what would be the red flags in the first trimester which should not be ignored under any circumstances.
So normally when we're talking about a pregnancy, we're talking about an intrauterine pregnancy, okay? A pregnancy which is growing in the uterus and everything. There's something called as an ectopic pregnancy, in which a pregnancy can remain trapped in the fallopian tube, or it may implant somewhere outside into the abdomen. Now, this is like a catastrophic condition. So, the way it presents can be sharp pain in the lower abdomen, maybe on one side. Okay, it may present with irregular bleeding. You may have like blackouts, attacks where you suddenly faint. So, don't take these things very lightly. So, you have to see a doctor. You have to see that, because this can happen before you go for your first scan.
Okay.
So, once you diagnose that there is an intrauterine pregnancy, then you are relatively less worried. But if it is an ectopic pregnancy, then it has to be dealt with very quickly. The earlier you diagnose it, the conservatively you can manage it. So it can be treated with medical management. Rarely, if it goes a little further, then it will require a surgical intervention. So that is one thing. So any kind of lower abdominal pain. So one cause of it could be an ectopic pregnancy. The second cause could be like a impending miscarriage. So don't ignore that if there is any spotting, bleeding. It may be nothing. I mean, it's not that every pain or every spotting is going to be a miscarriage. There may be other reasons for it, but do consult your healthcare provider to find out that everything is all right. Maybe you may be put on some hormonal supplements to support the pregnancy. And of course, all the obvious symptoms like, having vomiting, like so much so that you're fainting, like, then you get can get an electrolyte imbalance and all that. Then you may require admission. Okay. All this. So these are kind of the red flags. And of course, when you're pregnant, you can be like you are a person, so you can be attacked by any virus or anything. So you could get any infection like any other non-pregnant person. So anything you get because you're pregnant, you have to be more like careful.
Vigilant, yes.
Like don't say that, okay, this is like
normal viral and I can take
because what happens is in pregnancy, you are immunocompromised. Your body is trying to accept a foreign force. In the sense, the half genetic material is from the
other side.
Father. So the immune system is down to accept that.
True.
So all other infections you are likely to catch early. Anything like, if you treat in the early stages, is much better than compared to, you becoming like worse and then approaching a doctor.
Like listen to your mind. I think body gives anything which is making you feel there's something not right.
And please
turn to medical help. Like
turn to advice. It may be just reassurance that you need, or it may be certain things which need more attention. I think it's better to seek advice for sure. So the first trimester wise, I think is the most important because that's the stage when the embryo is forming. So if you want to kind of know the events, what's happening inside your body, is like when you've had the menstrual period, the first 2 weeks are the preparatory phase. So the body is trying to prepare for a pregnancy. And then you ovulate. So the egg gets released. And then the fertilization happens. So the fertilization is happening in the counted 3rd week of your pregnancy. Because we always count the pregnancy from the last menstrual period. So in the 3rd week, the fertilization happens following by the implantation. Whereas like you have a ball of cells which is called as blastocysts. So initially, the embryo is formed from the fertilized egg and the sperm. They join together. Then one cell divides into 2 into 4. And that way you get a ball of cells. And that is going to go and implant into the uterine lining. So that's week 3 of pregnancy. Then by the end of 4th week, we say, okay, you missed the period. And that's the time when on ultrasound, you can start seeing something like a fetal pole and a yolk sac. And then, so I'm just trying to take you inside the uterine cavity to familiarize you with how the baby is going to grow. And then the baby's embryo will form the placenta, which is the nourishing organ of the child. And the part of it will become the baby itself.
Right.
And by the end of the fifth week, your baby is about 2 millimeters. It's like, very small, like a grain, like poppy seed. And then you have the neural tube developing, then the heartbeat comes up in the sixth week. And then slowly by seventh, eighth week, you have the limb buds appearing, the head, eyes, all that start growing. And then by 8 weeks, now we say now your baby is no longer an embryo and it started becoming a fetus.
Wow.
So from ninth week onwards, then slowly, all the systems will start developing. By 10th week, even the reproductive, the genitalia, though we can't see them, but the genitalia have already started differentiating, whether the child is going to be a boy or a girl. That decision has been made. So that's how tiny it is. But it's a miniature first.
There's a miracle happening inside. Yeah, true. Absolutely. So I think, after that's, your wisdom, your knowledge that you shared today, I hope it's helping our audience answer all their queries, all their confusion in their head, or the doubts that they have. And yet, if you have any more questions, please always feel free to ask us. We are more than happy answering them. So thank you very much, doctor. It was amazing. For me also, it was a lot of insight. And thank you very much for being part of us. And have an amazing, joyful, informed, healthy journey ahead. Lots of blessings. Take care till we see you again. Bye-bye.
Thank you.
Thank you. Sure.